Hi, I'm Dr. David Samra, sport and exercise medicine physician and director here at Progressive Sports Medicine in Sydney.
And I'm Cameron Hyde, exercise physiologist and director of Hyde AEP in Sydney.
Through Progressive Longevity, we provide face-to-face, specialist-led care focused on prevention, performance, and long-term health.
And what we'll walk you through today is how that actually looks in practice. Not theory, but how we assess and manage patients day to day. Medicine 3.0 reflects a shift in how we practice. Traditional medicine works well once disease is established, when blood pressure is high, diabetes is diagnosed, or after a cardiac event. But the question we're asking is different. Can we identify risk earlier? And can we change its trajectory before disease develops? Instead of waiting for thresholds, we intervene upstream, often years earlier, to preserve function and independence.
And that leads to an important distinction here. Lifespan is how long we live for. Healthspan is how long you live well for. And clearly our focus here at Progressive Sports Medicine and Longevity is to maximise that health span. At Progressive, our goal is to help patients understand the science of prevention and apply it in a practical way in their own lives. We're trying to keep people functioning at a high level, physically, cognitively, and metabolically for as long as possible. And as you'll see through this educational series, earlier intervention matters. Risk is far more modifiable before symptoms begin.
And that's where education and data come in. We want patients to understand their own health, not just be told what to do. We also take a deliberately long-term view. We're thinking 10, 20, or even 30 years ahead. And more importantly, we link metabolic and musculoskeletal health because in practice, they're deeply connected.
Metabolic health really sits at the centre of longevity medicine. When you look at the major causes of death and disability, cardiovascular disease, cancer, dementia, type 2 diabetes, they all share common threads and common drivers. Chronic inflammation and metabolic dysfunction, particularly insulin resistance, are very central. And this isn't just about blood sugar and weight, it's a whole body state that also impacts musculoskeletal health. We see this clinically in things like tendinopathy and osteoarthritis.
Which is why this isn't just a medical issue. It directly affects performance and function as well.
Progressive Sports Medicine is a purpose-built clinic here in Leichhardt where we've developed and refined this model in real clinical practice. This is where the Progressive Longevity Clinic sits within our broader service. We'll now take you through how this whole process works. Phase 1, the entry phase for our longevity program, is about building an individualised health map. Over the first 6 weeks, we complete a detailed specialist assessment covering lifestyle, performance, and long-term risk. This includes a clinical examination, targeted biochemical testing, and we're looking at metabolic, cardiovascular, hormonal, and inflammatory health.
And alongside that, we add real-world data. We use continuous glucose monitoring to understand how your body handles fuel day to day. We assess fitness, body composition, and visceral fat. Then, as a team, physician, exercise physiologist, and dietitian, we integrate that into a personalised plan.
And at the 6-week mark, everything is consolidated together into one clear picture, so we have targets for the next phase. A full clinical assessment gives us information that telehealth simply can't. It allows us to connect your test results with real clinical findings. In this, we assess cardiovascular risk, musculoskeletal health, abdominal findings, and key metabolic markers. We also perform targeted ultrasound where appropriate.
And that's a key point. It's not just data in isolation. It's interpreted within a clinical context.
And that ensures that the program is grounded in proper medical guidance and not just numbers. Beyond general measures like weight, we use targeted clinical assessment and point-of-care testing. High-resolution ultrasound allows us to assess structures like thyroid, the gallbladder, the carotid arteries, and the musculoskeletal system more generally, with immediate clinical interpretation.
We also use DEXA scanning on site to measure body composition in detail, including visceral fat and lean muscle mass. That's critical for understanding cardiometabolic risk. The advantage here is integration. We review the results with you in real time and translate them directly into your program.
Our testing is targeted and clinically driven. We assess glucose and insulin dynamics when needed, rather than just relying on static markers alone. Cardiovascular risk is evaluated using ApoB, Lp(a), and other advanced lipid profiling. When appropriate, we incorporate advanced imaging such as a coronary calcium score or CT angiogram, and of course, we involve a trusted network of other specialists when it's needed.
And we extend that into other domains as required, including sleep, fitness, and strength.
The aim is to use this data to build a comprehensive, personalised health strategy.
We use a bespoke app to bring all of this together. It summarises key domains, highlights areas of risk, and tracks progress over time. So instead of fragmented data, you have something that's clear and actionable. Phase 2 is where we begin the application of our philosophy. Exercise is medicine. We use your individualised data to create a sustainable, realistic, and achievable plan. Over the next 3 to 6 months, your program is delivered with structured exercise and nutrition support. We work closely with you on training, behaviour, accountability, and progress your program accordingly.
And importantly, there's ongoing medical oversight here. So if issues arise, we step in early to keep progress safe and sustainable.
Training, testing, and clinical oversight all occur together. You're coached through strength and conditioning, monitored during testing, and tracked with repeated, gold standard, objective testing.
And this is where the data becomes meaningful and translates into action. Phase 3 focuses on long-term accountability and precision. At 6 and 12 months, we repeat key assessments to objectively track change. Everything is reviewed: training progress, investigations, and clinical status. And where appropriate, we communicate this with your broader healthcare team, including your GP.
And as a small specialist clinic, our focus is personalised collaborative care. We work closely together with all of the right people as a team.
And this is so patients are supported across all the domains of their health. At PSM, we apply the science of Healthspan in a practical, measurable way, helping patients understand and act on their health. This content is provided for general educational purposes only. It does not replace medical advice or consultation with your own doctor. No patient-doctor relationship is created by viewing this material. If you have symptoms or concerns, please speak with your GP or treating specialist.